Hello, welcome to ESO 2025. My name is Arif Khan. I'm Section Head of Pediatric and Neuro-Ophthalmology at Cleveland Clinic Abu Dhabi. And it's my pleasure to welcome one of our guest speakers for ESO 2025, Professor Charlotte Codina, who's Professor of Orthoptics at University of Sheffield. It's particularly a special occasion because this is the first time there's a dedicated orthoptics subsection within the ESO meeting. So it's a double honor to have you here. And thanks for coming.
Absolutely, my pleasure.
So, Professor Charlotte, there are many O's in eye care. We have ophthalmologists who are medical and surgical physicians that take care of eye disease. There are optometrists who primarily do refractive care. They also do, that is, dispensing glasses and contact lenses. They also do some primary eye care. There are opticians who dispense glasses. You are professor of orthoptics, and not everyone may be familiar with the role of an orthoptist or the field of orthoptics. Can you just tell us a little bit about that?
Absolutely, it'd be my pleasure. So orthoptics is probably the lesser known of the O's of eye care. We are one of the smallest allied health professions, but we're small but mighty. We specialise in binocular vision difficulties, in ocular movement difficulties, so difficulties when the eyes are moving around, difficulties when the eyes may not be straight, when there may be a squint or a strabismus. And sometimes these things can arise in childhood, so we also specialise in the development of vision, and we may be people who help with an eye that may be a little bit delayed in development, so amblyopia, lazy eye, patching, drops, and we may be those who provide a prism or exercises or an intervention to help when people have double vision, which can occur for a whole number of reasons. So we're involved in vision from infancy right the way through the course of life, and we are able to make a big difference in people's lives when we make those opportunities.
For sure. So many eye care providers are less comfortable with children because there are cooperation issues. Children are scared. How do orthoptists deal with children, and what is their role in evaluating children?
So lots of people think that it's difficult to assess vision, or some people even believe we can't assess vision in babies or toddlers, but we can. And as orthoptists, that's what we train and specialise in from the moment we start our professional careers. So we have lots of ways of detecting how well babies, infants, children can see through preferential looking. We can show stimulus that if they can see it, they will look to it. And orthoptists are famous for having lots of tricks up their sleeves. We've all got our toy bags where we can elicit visual responses, and it's a bit like being a detective. You piece the different pieces of the puzzle together to evaluate a child's vision. And we have orthoptists working in special educational centres or in places where children, schools for vision impaired children, where we're trying to maximise the vision that children have and look to see them reach their potential, because we know that when they reach that visually, they reach that globally as well. There's an interconnection there.
I have worked with orthoptists throughout my career, and one of the most amazing things that orthoptists do is assess vision in children. And this is something that often is neglected and not able to be done if there's not an orthoptist around. So that there are many things that orthoptists do, but I would say that's one of the biggest pluses that they add, at least in my practice. Now, you're professor of orthoptics. What's your role in University of Sheffield as professor of orthoptics?
So I'm the professional lead for our specialty. So we have orthoptics, we have a pre-registration program where we have undergraduates come and join us training to be orthoptists. We also have 2 other programs by distance learning, and those are post-registration programs, master's programs. We have one in vision and strabismus, and that allows people from all over the UK and the world to study with us online, and includes modules such as specialising in patients with low vision, patients who've had a stroke, in visual perception difficulties. So that's one of our master's programs. We also have one in advanced clinical practice in paediatric ophthalmology, which is it was launched in 2021. I lead that programme, and we have, again, students from all over the UK and indeed from the UAE studying with us. And paediatric ophthalmology is a specialist, a really specialist area that hasn't always had lots of people coming into it. But we think we've got orthoptists who have that essence and communication and skill in diagnosing and managing children already in orthoptics, who are advancing into that area of care and making a big difference in patients' lives.
So this program of extended skill set is really, really, really very powerful. So what type of roles do orthoptists have in clinical practice in the UK now? What are they doing typically?
So we found that most centres in the UK have orthoptists who have at least one extended role. So that varies. There are orthoptists who are specialising in stroke care, so they may go up onto the wards. There are orthoptists specialising in vision impairment, running their own low vision clinics. There are those who specialise with special educational needs, and there are those who are diversifying their skill set as well to take on additional roles. So I mentioned advanced clinical practitioner, and that's really a level of practice that's higher, that's trying to decrease the burden. We have a shortage of ophthalmologists in the UK, and the upskilling of orthoptists to be able to take on some of that workload. And there are some particular pathways. So paediatric ophthalmology is our special pathway in Sheffield, but in Liverpool they have neuro-ophthalmology, and we also have acute ophthalmology, and there are orthoptists working in glaucoma care. I could carry on.
So what I'm hearing from you is not only do orthoptists fill a void that is often neglected by ophthalmologists and optometrists in binocular vision and caring for children, they are now, because of their unique skill set, are doing basic skills in other fields of ophthalmology and optometry, and really are becoming very powerful independent providers. So this is why it's so important for us to have orthoptics now as part of ESO. It's such an important part of eye care. Just to conclude, I understand this is the first time you've come to the Emirates. I hope you've enjoyed your time here. Can you give me a little bit of impression of was it what you expected, anything you didn't expect?
Yeah, I've been absolutely delighted to be part of ESO. It's a real honour for me to be here and to visit the UAE for the first time. I have found people very warm. I've been really impressed with the hospitality. I feel very well taken care of, but I've also learned a lot. I've been very impressed with the level of clinical knowledge and care, and of the valuing of orthoptics within the wider field of ophthalmology. And I would love to see orthoptics grow in this region, and to see all centres having an orthoptist.
Yes, well, we hope you'll help us with this, and we hope this is not your final visit with us. Thank you so much for coming.
Thank you so much.